We receive patients from all over in Jaramogi, even from Uganda and Sudan.
What is the current uptake?
I don't know exact figures, but it's pretty big. I mean, you go to Jaramogi, you find it full all the time. If anything, we are expanding it.
Yes.
We are expanding. If you go there, you find that we're building a big comprehensive cancer care center. We are expanding the surgical wards. We are expanding the ward to do neurological problems. We have even, unfortunately for me, but it is necessary, we have built a new resting home, I mean, for the dead, you see what I mean? Because along with treating people, there is also the tragedy of losing people. And since we have a big clientele from around the region, we have to expand facilities. And sometimes, of course, there are certain services that are available only in Moi Teaching Referral Hospitals. Like Moi Teaching Referral Hospital so far has been leading in cancer treatment. It was the regional protocol for cancer. But that is why we are expanding our comprehensive cancer care center because of the demand for prevention of cancer and so treatment of cancer. The other thing that...
Do you have an oncology center at the referral hospital?
Cancer means partly oncology, you see what I mean?
Exactly.
You see, the point is that it is not just the physical facility you need the human resources. In order to have a comprehensive cancer center, you need oncologists of various kinds, by the way, because there are those people who are specialized in prostate cancer, some specialized in breast cancer, and so on. So when you are training oncologists, you must also be ready to know that you are going to be trained specialization within oncology. Then you have to have medical physicists who are very necessary in oncology. Those people who plan how you, for example, you're going to have radiation. Then you have cancer nurses. So there's a whole lot of specialties in the cancer space in terms of human resources that you need to have a proper comprehensive cancer care center. Unfortunately, we have never invested enough in cancer treatment. I remember when I was Minister of Medical Services, it's one of the things that I observed and started fighting very hard for the expansion of experts in cancer. And that is what led partly that quest. We worked very closely with Olive Mugenda for the establishment of comprehensive cancer care centers.
And Governor, still on health
University.
The issue, because we are in the Lake Region belt, which is quite prevalent. Malaria prevalence is here, and the HIV prevalence. What have you done as a government to eradicate the two menaces we have, malaria and HIV?
I don't think you can eradicate malaria that easily.
Prevention, of course, or even to reduce.
Reduction, yes. That's why I'm telling you the environment is important. The stagnant water is an invitation to have mosquitoes who will finally bite you and give you malaria. So eliminate stagnant waters in the villages. Make sure that you don't have too many surfaces with water, shallow, dirty, and so on, that can breed mosquitoes, okay? And then advise people to sleep under bed nets, okay? Bed nets will help very much, especially young people, to avoid getting malaria. And thirdly, there's a vaccination for malaria, but it's not very prevalent. I don't know why. So if malaria, unfortunately, visits you, then you have to have drugs to treat it. And I think the incidence of malaria has gone down considerably in this region. I don't think it is as prevalent as... There was a peak, I think, some time ago where malaria was very, very prevalent in the region. But there are certain seasons, like rainy seasons and so on, when you get more incidences of malaria. But what we are saying in Kisumu County, prevent it. Fight the war for preventing malaria more than fighting the war for curing it. Because if we prevent it, you don't need to spend too much money curing it.